Hello, this is Dr. Ruby, and welcome to the second lecture for Module 5, Roles of Muscles. Again, at the beginning of our presentation, we have the lesson objectives. Please use these to prepare for the quiz. Just because a group of movers exists doesn't mean that every muscle of that group necessarily contracts every time and the action in question occurs. One or a few muscles can contract to create the action in question. Movers are muscles that can do the action in question. They can shorten in two ways: concentrically, where they contract and shorten, or they can relax and shorten. For every joint action, a functional group of movers can contract to make the action happen. In this illustration, the brachialis is the mover. Movers that do the same motion would be called assistant movers. Movers are also known as agonists. In the picture on the left, gravity acts as the mover. In the picture on the right, the force of the opponent's pull acts as the mover. The name antagonist literally means anti-agonist, anti-mover. However, the actual definition of an antagonist is a muscle or other force that can perform the action that is the opposite of the action in question. In other words, the antagonist must oppose that particular action of the mover. Again, they can lengthen in two ways: eccentrically, contract and lengthen, or they can relax and lengthen. They're sometimes called the contralateral muscle or the opposite side muscle. Every muscle that flexes the forearm at the elbow joint is an antagonist because every elbow joint flexor opposes the action in question. Why is gravity an antagonist in these pictures? Well, it's because the motion is upward, flexion of the forearm at the elbow joint. Every extensor of the elbow joint is an antagonist, even if it is not working. A contraction of the agonist and antagonist muscles at the same time is generally not considered healthy. It's the same as pressing gas and brake pedals simultaneously. However, there is one time when this co-contraction may be beneficial, and that is when the stabilization of a body part is needed. This co-contraction is desirable, and it often occurs when we stabilize. Since gravity affects every movement in the same basic way, it's always pulling down, it provides an effective way to determine which muscle is working in any given situation. Of course, there are exceptions to these rules. We can supplement gravity to move downward more quickly, for instance. There are three general rules. Upward movements are where movers work and antagonists relax. Horizontal movements where movers work and antagonists relax. Downward movements where antagonists work and movers relax. In these two illustrations, can you guess what role gravity plays? Gravity is an antagonist in the scenario depicted on the left, and it is a neutral force in the scenario depicted on the right. What is the role of gravity in this illustration? In this illustration, gravity is a mover. Stopping unwanted actions of the muscle that is working. Fixators and neutralizers both stop unwanted action of working muscles. Fixators stop the action at a fixed attachment. Neutralizers stop the action at a mobile attachment. An example is the flexion of the fingers into a fist. Practice flexing your fingers into a fist and simultaneously palpating both your own wrist joint extensor musculature and the common extensor tendon. You can feel the contraction. Why are the wrist joint extensors contracting when the fingers flex? They are contracting in order to fix or stabilize the hand at the wrist joint so that the finger flexor muscles do not also flex the hand at the wrist joint. Here are the objectives for Lesson 13-2. Fixator muscles. These muscles stop unwanted action at the fixed attachment of a muscle that is working. They are also known as stabilizers, and they contract isometrically. Look at the action in question that is occurring. Whichever body part is moving is the mobile attachment. Whichever body part is not moving is the fixed attachment. In the illustration on the right, the posterior deltoid acts as a fixator of the arm by creating a force of extension on the arm at the shoulder joint. This prevents the bicep brachii from flexing the arm at the shoulder joint. In this figure, the rectus abdominis is acting as the fixator because it prevents the tensor fasciae lata from anteriorly tilting the pelvis. Here are the objectives for section 13-6. In any given action, the mobility muscles would tend to be the movers of the joint action. But core stabilization creates stronger and more efficient movements of our bodies. If we stabilize our core's axial body, then we can channel all the strength of our muscles' contractions toward moving our extremities. If the vertebrae in this scenario are not fixed, then they will move every time the arm abducts. This can eventually result in excessive wear and tear and therefore damage to the spine. Neutralizers stop unwanted action at the mobile attachment of the muscle that is working. They create a contraction force equal in strength but opposite in direction to the force of the unwanted action. There are three cardinal planes, the sagittal, frontal, and transverse. If we assume that the desired action occurs in one of these planes, we should also recognize that the undesired actions might occur in the other two, were it not for the presence of neutralizers. In figure B on the right, why is the sternocleidomastoid a neutralizer? It's a neutralizer because it cancels out unwanted actions of the right levator scapula. Neck flexion cancels out neck extension, and left rotation of the neck cancels out right rotation of the neck. In this illustration, the pronator teres is the neutralizer because its action of pronation of the forearm at the radial-ulnar joints cancels out the bicep brachii action of supination of the forearm at the radial-ulnar joints. This is a method for determining fixators and neutralizers. First, determine the action in question. Determine the muscle that is working and its role. Determine the fixed and mobile attachments. List all actions of the muscles that is working and state whether the actions are desired or undesired. Then determine the action of each fixator at the fixed attachment. Choose a muscle that can do the action determined for each fixator. Determine the action of each neutralizer at the mobile attachment. Choose a muscle that can do the action determined for each neutralizer. Once you have this step-by-step rubric down, you will eventually become proficient at determining the fixators and neutralizers associated with a particular action. In this diagram, the levator scapula is contracting. It is the muscle that is working. It is the mover. The SCM is a neutralizer, and the lower trapezius is a fixator or stabilizer. Here are the objectives for Lesson 13-3. Support muscles. Support muscles usually work far away from the joint where an action is occurring. They hold another part of the body in position while the action in question is occurring. They do not work directly at the joint. They oppose the force of gravity on a body part, and they contract isometrically. In this photo, the left-sided erector spinae musculature supports this action. Its force of the left lateral flexion of the trunk at the spinal joints prevents the trunk from falling into the right lateral flexion of the trunk at the spinal joints. Synergists. Synergists are muscles or forces that work with the muscle that is contracting. So the biceps brachii and the pronator teres are both performing the same action here, and therefore they are synergists. In the sagittal plane, these muscles are synergists. In the frontal plane, however, they are antagonists. It's the right external abdominal oblique and the left internal abdominal oblique. Coordinating muscle roles. Muscles rarely act in isolation. A number of muscles may contract for any given joint action. And coordination is the co-ordering of muscles in the body in their various roles to create smooth and efficient movement. It takes humans so long to become coordinated because coordination of multiple movements and contractions is enormously complex. The more complex, as in athletics or dance, the longer it takes to achieve proficiency and economy of movement. There are some clinical effects of isometric contractions. They tend to close off veins for the entire length of the contraction. There's a buildup of toxic waste products, and the waste products can irritate the nerves. This loss of arterial blood supply to the tissues of the body can cause ischemia. One way to explore the complexity of coordination is to lift a heavy weight in your right hand, as shown in the illustration, and slowly palpate the pronator teres, biceps brachii, posterior deltoid, and left erector spinae. You will be able to feel each of these muscles as they work in concert to lift the weight. Second-order fixators are fixators that fix attachments of the fixator or the neutralizer muscles. In this soccer scenario, the support muscle is keeping the player from falling to the ground. In coupled actions, two separate joint actions must occur simultaneously. Abduction of the arm 180 degrees relative to the trunk really consists of two separate coupled joint actions. The two separate coupled joint actions are abduction of the arm at the shoulder joint and upward rotation of the scapula at the scapulocostal joint. These two motions occur in concert and allow for free movement of the glenohumeral joint that is efficient and protects the small ligaments and joint surfaces. That's the end of our lecture for Module 5.